Inquest. Verdict.
A death in home share.
Let's just start with the hard facts, straight from the coroner's inquest.
Okay. Date and time of death, February 10th, 2011 at 07:48 hours.
The hearings for the inquest were June 11th to 15th, 2012.
And the manner of death was ruled accidental.
But then you get this discrepancy in the evidence summary.
Right. And it's probably got the wording exactly right here. It says, on the morning of February 11, 2011, Miss Andrews was found.
So a death timed on the 10th.
And a discovery on the morning of the 11th. We're not commenting on it, just stating what's in the record.
Exactly. Now let's widen the lens a little bit, because this wasn't treated as just a single, isolated tragedy.
No, not at all. The scope of the recommendations that came out of that inquest tells the real story.
It does. They didn't just target one provider or one home. The recommendations targeted all home share providers.
And all staff at CLBC, that's Community Living BC. That's the key.
When you do that, when you mandate training and, unannounced checks for an entire system.
You're admitting the issue is system level. You're not just fixing one broken part.
And we need to be very clear about the context here, about the level of vulnerability.
The documents are explicit. This individual had the cognitive capacity of a 6-7-year-old.
A 6 to 7-year-old, and was unable to live independently her entire life.
So this isn't a case where, just checking in once in a while is enough.
No, the system itself is supposed to be the safety net.
Correct. Which brings us to the next big document in the timeline. After that inquest in 2012, CLBC commissioned an independent review.
Right. This was the one they worked on from January to August 2013, published that October.
And they're pretty clear about why it was commissioned. It wasn't just internal curiosity. The text explicitly cites media and advocacy attention.
So there was external pressure building.
Absolutely.
Oh.
Okay, so let's unpack this review, because once you read the fine print, you see some massive guardrails on what they were actually allowed to investigate.
Two really big ones. The first one is money.
It's stated right up front. Home share funding was not within scope of the review.
That seems huge. You're doing a deep dive on a support model, but you're not allowed to talk about the money.
A financial analysis was excluded by design.
And the second limitation.
Time and resources. They pretty much admit they couldn't hear from a large number of people.
I saw those numbers. They explicitly list hearing from, 14 coordinators, 6 senior staff?
All internal administrative type role.
Exactly. But there are over 3,000 people actually using the service. How many of them were interviewed for the report?
The document doesn't give a specific number. We know some were, but there's no hard total like there is for the staff groups.
So keeping those limits in mind, no money, limited voices, what did they actually find?
Well, it's a classic case of paper versus practice. Meaning the review found that the paperwork, the whole framework on paper, it looked coherent. It looked complete.
But paperwork doesn't actually keep people safe.
No, it doesn't. And the review admits that safety relies entirely on what it calls nuanced monitoring. And that's where the friction was.
Private homes, they create blind spots.
And communication was found to be inconsistent. But this is where it gets really interesting to me.
Go on.
Even though they were told funding was out of scope, it still forced its way into the findings.
It had to.
It had to. The text explicitly admits that funding is a major barrier to safety. You just can't separate the resources from the risk.
So you have a review in 2013. It identifies blind spots, communication gaps, funding barriers. What happens next?
Well, this is where we fast forward. The official home share review response. 5-year plan. It wasn't released until May 5, 2015.
Wait, hold on. May of 2015?
2015.
The review was published in October 2013.
That is the timeline.
So what does this mean for you, the listener? We're talking about safety recommendations for vulnerable adults.
It raises that ultimate question of governance. When you have nearly a 2-year gap between receiving clear safety recommendations and releasing the plan to address them.
Is that a sign of mature, careful consideration?
Or is it administrative inertia? That's something to think about.